In this video, I will guide you through the user interface of the Veta5 anesthesia machine. There are curves on the left and numbers on the right side. This is the Capnograph curve here. This shows the CO2 level in the airways over time. The measurement unit is millimeters of mercury. The lower curve here shows the airway pressures in centimeter of water over time. The time scales for the Capnograph and for the airway pressures are matching. The large number here show the measured parameter values, and the small numbers on the right side show the alarm limits that can be changed later. This number here is the ETCO2, which means end tidal CO2. This value is derived from the Capnograph curve on the left. In our case, this value is 44 millimeter of mercury. We use end tidal CO2 to define ventilation. The normal range in dogs is 35 to 45 millimeter of mercury. It means that the end tidal CO2 value of this dog, which is currently being anesthetized, is within the normal range, so the dog is normal ventilating. Next to the ETCO2, we can see the alarm limits for this parameter. By default, the lower limit is set to 25 and the upper alarm limit is set to 50. If the end tidal CO2 value, which is measured here, would become outside of this range, an alarm would sound. FiCO2 here means the inspired fraction of carbon dioxide, and it is also expressed in millimeters of mercury. You can use this number to monitor CO2 rebreathing. As you can see, in this case, this value is 0, which means that the animal currently being anesthetized, which is a small dog with 5 kg body weight, is not rebreathing CO2. If the FiCO2 reaches 4 millimeter of mercury or higher, an alarm will sound and you will need to change the soda lime. To help the user identify which numbers and curves belong together, the colors of the numbers are matching with the corresponding graphs. The white colors here indicate CO2 measurements, and they are corresponding with the color of the Capnograph curve on the left. And the yellow numbers here indicate the peak inspiratory pressure and the positive end expiratory pressure, the PEEP. And the yellow color corresponds to the color of the airway pressure graph. In our case, the peak inspiratory pressure is 8 centimeters of water, which means that the highest pressure during inspiration is 8 centimeters of water. The PEEP in this case is 2 centimeters of water. As you can see here, the PEEP parameter is set to off, but this value is still 2 centimeters of water. The reason for this is that the ventilator has ascending bellows, and we need to keep a certain pressure in the breathing circuit to keep these bellows floating. Without this pressure, the bellows would be collapsing at the end of expiration and the patient would not be able to breathe. And this pressure at the end of expiration is in fact the same as the PEEP. Without a PEEP, we would not be able to ventilate any patient with this or with any similar ventilator. Hence, some level of PEEP is unavoidable with this system, and in this case of the Veta5, this default PEEP will be a similar value for both the small and the large ventilator bellows. Even if the patient is breathing spontaneously from a reservoir bag, like this one here, there needs to be a PEEP to keep this bag open, nice and inflated, so that the patient can freely breathe from it. Often this pressure is rather small, about half centimeter of water is enough, but it should never be 0, otherwise the bag would collapse and the patient couldn't take a breath. Using the advanced APL valve of the Veta5, a PEEP of 1 to 3 centimeters of water is often retained even when the valve is completely open. It is normal and acceptable. If you have higher values, you may want to ask your technical support about it. Now let's see the next parameter. Vt here is the tidal volume in milliliters. In other words, it is the volume of a single breath. Mv here is the minute volume, which is the sum of all breaths through 1 minute. Rr here is the respiratory rate. If we understand this, we can easily calculate the minute volume by multiplying the respiratory rate with the tidal volume. There are a few virtual buttons on the right side. Let me quickly explain. If this button here is the audio pause. So if you have an audio alarm and you would like to pause it, you press this button and the alarm will be quiet for 2 minutes. Here, if you press the alarm setup button, you will have a new window popping up, which gives you a chance to set the higher and the lower alarm limits separately for each variable. Interestingly, for the peak inspiratory pressure, the high alarm limits are defined separately for patients with different body size, and this is a very user-friendly possibility. The inspiratory breath hold button here is used during a CT scan where you need to maintain a sustained inspiration during the scan. If you press and hold this button, then the next inspiration will be maintained as long as you press this button, and you can complete the CT scan. The lowest button here is the end case button. You will have to use it after you finish this anesthesia. At the bottom of the screen, you will find tabs for the ventilation modes. You can control the ventilator from here. Depending on which version of the Veta5 you have, there can be maximum 5 ventilation modes you can choose from. VS means volume support mode, and it is the default ventilation mode of the Veta5 machine. My name is Dr. Tamás Ambrisko, and I'm a veterinary anesthesiologist. Thank you for watching.